One of the best things about practicing medicine in a state that has an infertility insurance law is that I actually get to practice medicine, is that I get to diagnose my patient's infertility, figure out why it is that they can't get pregnant, and then actually be able to treat them for this condition. It allows me to provide the best evidence-based medicine for an actual medical condition without having to focus on all of the financial aspects that otherwise would significantly hinder care.
The infertility insurance law allows me to practice medicine in an evidence-based manner without regard to worrying about finances. It allows me to treat anyone who needs services to walk in, be treated, and get the top-notch care that they actually deserve, without limitation of the fear that they won't be able to afford it.
When I sit down with patients after doing their initial workup, really what we can do is get into a conversation about what's the most appropriate medical treatment. So it's not necessarily a conversation driven entirely by what's the treatment we can afford, what's the treatment that fits into our situation, but really, hey, here are the options that make sense for you based on what your diagnoses tell us and what's most appropriate for your particular clinical situation.
So the infertility coverage law gives patients the opportunity to seek treatment that they otherwise probably wouldn't have access to. If people had to pay out of pocket for their fertility care, many people would not be able to pursue it. And they also wouldn't be able to pursue some of the more expensive treatments, like genetic testing on embryos. They may be pressured to transfer more embryos because they feel like they have one opportunity. Being able to have access to that care allows you to do fertility treatment in the safest, most effective, and scientific way.
So on balance, I'm happy that we're able to operate in a state which has an insurance law. It's been very good for our patients, clearly. Our patients now have coverage and are able to afford care. But for us as physicians, as CEOs of healthcare companies and certainly IVF programs, the ability to be able to help as many patients as possible is clearly an advantage.
How I feel when I encounter a patient that has either exhausted their insurance benefit or has no insurance benefit is truly heartbroken. As a parent myself, if somebody wants to bring a child into their home, this is what I do. And to not be able to take them to that next step is beyond unfortunate. It's really, a misappropriation of our medical knowledge. We can help the vast majority of patients, and to not be able to do that really makes me feel powerless and sad for them and for this family that could be if we could offer a benefit.
My mission as a physician, my passion as a physician, the reason I became a physician, and particularly the reason I chose this field, is that I want to help people. I want to provide care to people. And in this field, we're very fortunate that we have treatments for just about everything that we see. So when I have a patient that I have a treatment that will work for them, but they can't access that treatment because they can't afford it, it crushes me, and I feel completely helpless as a physician.
If I had to choose one word to describe how I feel about the insurance law in Massachusetts for infertility, it would be grateful. Grateful as a physician, grateful as a former patient, as a sister, as a friend to a lot of people who have needed to benefit from this law.
I'm Alan Penzias.
I am Mark Segal.
I am Christine Skiadas.
I am Alison Zimon.
I am Mark Leanderis.
I am Jason Bromer, and I am grateful,
Honored,
Thankful.
I am privileged.
And I am thrilled to practice.
And I'm proud to practice in a state with a strong infertility insurance law.